Hello, my name is Penda Boma. I am a student of Nightingale College. Today I'm going to be performing hand washing and sterile gloving skills. I'm supposed to be dressed in my uniform, but due to high demand from my peers, my uniforms are being delayed in transit. So I have my badge and I have my sterile gloves. I have no nails and no jewelry on, so I'm going to go ahead and start performing hand washing skills. I am going to adjust the camera to a position where you can see. Okay, right there. My face might not be in the camera all the time, but here we go. So for this procedure, you want to make sure that your hands do not touch outside the sink, which is this area outside the sink or inside the sink. I'm going to go ahead and turn on the water and make sure that it is warm, not cold, not hot, because you don't want your body to be cracked. So the water is warm enough. You want to maintain this position so that as you are washing your hands, any contaminations go down, not up. So I'm going to go ahead and start wetting my hand from my wrist down, making sure that I am not touching the sink or the outside of the sink. From my wrist down. Now that my hands have been soaked completely from the wrist down, I'm going to go ahead and apply some soap. About 3 to 5 milliliters of soap. I'm going to start washing for at least 15 seconds. I'm going to wash the inside of my hands. I'm going to wash my knuckles. I'm going to wash in between my hands, my fingers. I'm going to wash the outside of my hands from the wrist down. Even though I don't have no nails, I'm still going to go ahead and try to make sure that no dirt is in between my nails. And I'm going to do that for all 10 fingers. Then I'm going to continue scrubbing the back, inside, in between the knuckles. Now that my hands have been washed, remember, you need to maintain this position. I'm going to go ahead and let the water roll off my hands from my wrist down. Making sure that I am not touching the inside of the sink or the outside of the sink. Then I'm going to make sure that the water is rolling off my wrist. I am not fighting with the water. I'm not touching anything else, but just the water is doing its job from my wrist down. Okay. Now that my hands are washed, I'm going to go ahead and get some paper towel, and I'm going to start with my fingertips. As I do that, I'm going to dab. Watch how I do it. I dab. I don't rub it. I just dab. I dab. I am done with the first hand. I'm going to discard of this paper towel, and I'm going to get the second one, and I'm going to start with my fingertips. Then I'm going to dab from my wrist down. I'm going to dab it. Dab and dry. Dab. Now that I am done drying my hands, I'm going to discard of this one, and I'm going to use another paper towel to turn off my water. And I'm going to discard of this one too. Okay. Now I'm going to go ahead and perform Now I am going to go ahead and perform my sterile gloves skills. I am in a dry, flat, clean surface. I have to inspect my gloves to make sure that they are the right size and they are exactly what I need for this procedure. This is my sterile gloves. I'm going to go ahead and continue with this skill. First, I inspect them and make sure that they are the right size and they are properly exactly what I need. So now I'm going to use my thumb to open it up all the way. This is what I need right here. So I'm going to discard of this. This is what I need. This is exactly what I need. So my sterile gloves is right here. It's ready to be used. I have a 1-inch border around my paper which I can use. So I'm going to go ahead and open my gloves. Make sure that it is I'll put my hands under this border part and I will open up. I'll open it up. I'll open it up. I have a 1-inch border that I can touch all around this paper. I'm trying to make sure that you can see my entire, sorry about that. I'm trying to make sure you can see my entire, okay. So my sterile gloves are in. I'm trying to inspect them to make sure that the thumbs is outside. Okay, thumbs are outside. I am going to start with my dominant hand. So I'm going to grab the cuff and I'm going to insert it. I'm going to insert my dominant hand first. Be very careful. Make sure you are only grabbing that cuff. So my dominant hand is on. I'm going to put my 4 fingers into the next glove. Remember, watch how this paper is moving. You have to make sure that it is still. And I'm going to insert my hands, my fingers in this. Now that I have this one in and it is sterile, I could go ahead and adjust my gloves, making sure that they are well fitted, not too tight, not too loose. My gloves fit really good and they are sterile. So now they are ready to be used. They are ready to be used. They are comfortable and they are my size. At this moment, I'm done putting on my gloves and I am done performing my patient care on my patient. So now I have to discard of the gloves. So what I would need to do is I pinch the inside of the gloves while I pull it out. Pinch the inside, pull it out. It can be difficult, but you got to pinch the inside, making sure that as you pinched it, grab the inside because the outside might be contaminated. You form a fist into the next hand, and then you want to go inside the other gloves, inside, and pull it out to avoid contamination. And my gloves are off, and I'm going to discard this too. And then I'm going to discard this as well. Now that my gloves is off my hands and I've performed patient care, I am going to go ahead and perform hand hygiene again. I will proceed by providing patient privacy, and I'm going to exit the room to go and document my procedure and what I did for the patient on the chat. Thank you.